Good afternoon. Can you see me? I can't see anything. Okay. I'm sorry. Just on my side, let me. All right. Great. Thank you. Um, just having a little bit of technical stuff on my side. I cannot. Mohammed, can you come on, please? Are you able to? My apologies, folks. All right. I guess I will just get started here because I cannot hear or see anything on my side. Um, all right. All right. I'll just get started then, and hope it all is good. And I can see the chat over here. So if anything, just please let me know in the chat, and we will go from here. All right. All right. Greetings, everyone. Salam. I am Dr. Bishara Wilson. What's going on here? All right. Greetings, everyone. Again, salam. My name is Dr. Bishara Wilson. I'm a doctor of acupuncture and traditional Chinese medicine. I'm based out of Brooklyn, New York. I used to work with Muhammad Kamel up at a center where we treated people that were in car accidents. We treated a lot of people in a day, 30, 40, 50, sometimes 60 people a day. And so Muhammad has so graciously asked me to come on and speak to you all today on an introduction to Chinese medicine. So I'll just go and get started. So just to give you a little bit of my history, I first became interested in holistic, like natural medicine back in the early 90s. In the 80s, my mother, she had a lot of health books around the house. And in around 89, 90, my mother, she had to get a surgery. And as part of that surgery, someone had advised her to start eating like a lot of whole foods, not eating any junk food and things like that, staying away from meat. And she got better quickly. And so it really piqued her interest. And so with the books and things she had around the house, I would kind of flip through them and study them and, just kind of look through them. And then when I got to college, undergraduate, I began to read a lot more on herbal medicine, natural healing, metaphysical sort of thinking, different religions around the world, and cultures and things like that. And so for my senior year, undergraduate, I majored in African American studies. And so for my senior project, I wrote a book that was about 55 to 60 pages long called Good Health and Well-Being for African Americans. And so from there, I knew I wanted to see if I can take this on professionally as a degree. Excuse me. Taking on professionally as a degree. So after I graduated, I applied and was accepted to the Pacific College of Oriental Medicine, what was called now. They actually just changed the name recently. And my main interest was herbal medicine. And so with the school, finished there in 2002 with a master's in acupuncture and Chinese medicine. While I was in school, we learned a lot of Western science in terms of physics, biophysics, biochemistry, anatomy, physiology, in addition to Chinese medicine, philosophy, acupuncture, herbal medicine, nutrition, Qigong, Tai Chi, a lot of things that we're going to talk about today. So, what I will do is I will go through some of this info quickly as possible, but I also would like to field any questions that you all may have in the chat and things. I wish I could see you all. Maybe they can be brought in. Well, hopefully we can figure that out. And so when we look at Chinese medicine, a lot of Chinese medicine is rooted in the Tao, which is, I guess, Chinese spiritual religious philosophy translating to the way, in terms of the way of nature, the way of the universe, the way of the creator. A lot of people are familiar with the Tai Chi symbol, which is, usually call it the yin yang symbol. And with yin yang, it deals with duality, the balance of things, whether you're talking about light and dark, male and female, up and down, forward and backwards, left and right, hot and cold, so on and so forth. You can imagine all of the different things that go into like a duality or group of opposites and things like that. Let me just check this chat. So everyone, I'm coming through clear to everyone? Hold on one second. All right, great. All right, so I'm sorry, we experienced some technical difficulties here. Mohammed, I'll just text you. Bear with me, folks, please. Bear with me, folks. We want to get this right. Can anyone see how many oh, okay. All right. All right. So I'll just continue. I will just continue along with this. Thank you. Thank you all. I appreciate your patience. All right. And so we talk about chi, and chi is like like vital energy, vital life energy. Part of what the root is also when we're dealing in acupuncture and Chinese medicine philosophy, they deal with the five elements. They deal with the five elements. And the five elements are wood, fire, earth, metal, and water. And the five elements correspond to everything in nature. Whether you're talking about the different organs of the body, the planets, colors, temperature, seasons of the year, times of the day, tastes, you name it. So, for example, with the wood element, we're now in the spring season, and the spring season is ruled by the wood element. The organs that relate to the wood element in the body are the liver, which is a yin organ, and its paired organ, the gallbladder, which is a yang, or we say yang organ. The liver, say it opens up to the eyes. And so just to kind of go through it real quickly, just to give you an example, with fire is the heart and the small intestine. And the fire element, the heart and the small intestine opens up to the tongue. The wood element is ruled by it rules the spleen and the stomach. The spleen opens up to the mouth. The metal is the lungs and large intestine that opens up to the nose, and the kidneys and the water element is the kidneys and the urinary bladder, and that opens up into the ears. And so just to kind of go back through some correspondences, the taste of the liver is sour. The taste for the heart is bitter. The taste for the spleen is sweet. The taste for the lungs is acrid or pungent, things like onions and garlic and things like that. And the taste for the kidneys is salty. We say the wood element is the eastern direction, the fire element is the south, and so on. It goes all through and things like that. And so, with all of those correspondences, that's a basis for the theory. In Chinese medicine, we also deal with qi and blood. Again, your qi is the vital energy of your organs, and your blood is that nutritious substance that flows all through our body that corresponds to the red blood that flows through our veins. Um, when we're doing with diagnosis, we go through a system of 10 questions. So, for example, someone may come in and they usually have a chief complaint. And so for me, my specialty is sports medicine. A lot of people that I see are coming in with back pain, knee pain, shoulder pain, hip pain, so on and so forth. And so even with them, I have to understand what's going on with their entire body as opposed to just treating the injury, because we are a whole person. And with that, if I don't treat the whole person, then the injury may come back. So if someone's coming to me with knee pain, for example, but they have like digestive problems and so on, the digestive problems are more important to your body than the knee pain. And so your body's intelligence is really working on number one, trying to balance your digestion, which is one of your basic processes of the body, and then it's working to deal with the pain. And so if I don't align someone's and fix someone's digestion, then the knee pain will come back. Going back to the five element theory again, when we're looking at it, um, each of the elements under the different each of the organs under the different elements also rule different organ systems of the body. For example, the liver rules the sinews, so like the tendons and the joints. The heart rules the blood vessels. The spleen rules the stomach. The spleen rules the muscles, and the lungs um, rule the skin, and the kidneys the bones. And so going back to the first example I just gave, if someone has digestive issues, the which is the spleen in the stomach in Chinese medicine. The spleen in the stomach also rules the muscles. And so if someone has a muscle injury and they have digestive issues, if we don't balance out those digestive issues, if we don't balance out those issues of the spleen in the stomach, the muscles, which also correspond to that same element, will not fully heal. And so a lot of times when we have injuries, it's not just a physical injury, but it's also an underlying internal problem that we have. So I'll continue. So a person comes in with their chief complaint, similar, I'm sure, to if some of you or, anyone in the medical field will ask, how did it happen? How long have you had it? What makes it worse? What makes it better? And then from a Chinese medicine standpoint, we ask 10 questions. So I'm going into, actually ask a lot more than 10 questions, but it's pretty much 10 categories of questions. So ask someone, how their energy level is, their temperature. Do they get hot easily? Do they get cold easily? How much do they exercise? How much sleep are you getting? We go into your head, eyes, ears, and nose and throat. So any headaches, lightheadedness, dizziness, nasal congestion, sore throat, any chest congestion, difficulty breathing, heart palpitations, shortness of breath, any rib side pain, digestive issues, any bloating, gas, acid reflux. How often do you move your bowels? The quality of your bowel movements. Do you tend towards cravings towards any particular taste? So, do you like sweet foods? Do you like salty foods? Do you like bland foods? Go into, again, your sleeping habits, any pain that you might have. Reproductive system with women. Is your cycle regular? How often does it come? How long does it last? Any breast tenderness, cramps, so on and so forth. So we go through all the different systems in your body. And so what that does is that gives us an idea of what's going on with you from a constitutional level, from a root level, just from those questions. Then with traditional Chinese medicine, we also do tongue diagnosis. So when we're looking at someone's tongue, we're looking at the color of the tongue. We're looking at the coat on the tongue. Is it a thin white coat, which is normal? Is it a thick coat? Is it patchy in different areas? Is it like totally bare and peeled in certain areas? The color of the tongue. Is it a pink tongue, which is a regular color tongue? Is it red? Is it pale? Is it purple? Does it have like a dusky, like kind of dark color to it? And also when we're looking at the tongue, one of the things unique to Chinese medicine, we break up the tongue into different areas, which actually correspond to different organ systems in the body. And so when we're talking about the organs of the body in Chinese medicine, we're talking about it from a Chinese medicine standpoint, not necessarily from an anatomical and physiological standpoint from Western medicine, where sometimes it correlates. Everyone's putting up. What does that mean? Could you not see me for a while? What does up mean, everyone? I want to make sure that everyone's hearing me. Someone explain. All right, I'm just going to keep on going and again, hope that you see me. All right. And so going back to the tongue, when we look at the tongue, we break the tongue up into the main organ systems of the body, which correspond to those 5 elements. So the tip of the tongue relates to the heart. Right behind the tip of the tongue, that area relates to the lungs. In the center of the tongue relates to the spleen and the stomach. The root of the tongue in the back relates to the kidneys and like the lower part, like the intestines and things, and the sides of the tongue correspond to the liver and the gallbladder. And so when I'm looking at the tongue again, I'm looking to see if the color of the tongue. If the tongue is pale, oftentimes that relates to a blood deficiency, where the person doesn't have enough blood flowing through their body. Sometimes in Western medicine, that correlates to anemia. Sometimes and you can even look at your tongue now. Sometimes the person, they have like tooth marks on the side of the tongue. That's almost like we call that, it's like a flabby tongue, where the tongue is holding water. If you ever have gone to like your grandparents or parents' house and they have like swollen ankles, and you push into it and it kind of leaves like a finger mark, that's because the body is like holding a lot of water in that area. And so if you have tooth marks on the side of your tongue, it shows that your body is like holding a lot of water, and you have some imbalances with your digestion. So along with that, we also do pulse diagnosis. So we feel with 3 fingers along, like the radial pulse, we'll feel it on the top, we'll push in and we'll push far. Similar, and push deep in. Similar to the tongue diagnosis, the different areas of the pulse under my fingers on the right and left um, pulses on the radial pulse at the wrist correlate to different organ systems of the body. And so we're looking at um, the flow of your body's flow, and the quality of your energy also, in terms of the quality of your chi and blood circulation. And so I'm looking at like the strength of your pulse, the speed of your pulse, and other qualities of the pulse. If someone is weak or has like a weakness of their chi or weakness of their blood, a lot of times I'll feel their pulse very deep to the body, and it'll be very faint, like very thready, we'll say. Sometimes when people are under a lot of stress, I'll feel their pulse, and we call that a wiry pulse, where it feels like tense, like a piano wire, where if someone's pulse is like really tired and weak, it'll hit like this. And other times if someone's stressed, like I'll literally feel like their pulse like this. Or sometimes a pulse can be like skip a beat, which is showing some irregularities with the heart. So the pulse diagnosis, the tongue diagnosis, along with the questions and the chief complaint, that gives us an idea of what's going on with the person in the body. And so from there, we make a Chinese medicine diagnosis. And so, going back to the example with digestive issues, you can have a whole family of people that are showing up with indigestion, but you can have separate root causes. For example, you can have someone who has digestive issues because they eat a lot of sweet and greasy foods, a lot of heavy food, cakes and cookies, fried foods, and things like that, that upset the digestion. Then you can have someone that eats a lot of cold foods, a lot of cold smoothies, iced drinks, ice cream, cold everything. And that cold damages the digestive fire, and that shows up as indigestion. Then you have other people that get very nervous. And we say that nervousness, which correlates to the energy of the liver, is overacting on the digestion. So they have like a nervous stomach. Um, and so all 3 of those people may have weakness. They're all showing up with indigestion. But for the person that's eating the sweet foods and the greasy foods, I'll give them something for their um, in terms of just some basic things to balance out and support their digestion, but they have to stop eating their foods, and we'll put other herbs and things, for example, that help to, get rid of that excess grease and fat that's building up in their body, that's throwing off their digestion. Then the next person that's eating cold foods, I would modify and tell them to make sure they consume their foods at least room temperature or hot, and give them certain hot spices like ginger or dried ginger and peppers and other herbs and things like that that will warm the inside and spark that digestive fire. The other person that's anxious, we may give them some acupuncture and points that help to relax their mind, in addition to the points and herbs for their digestion. And so we'll do that. And so with the lungs, with the liver, we'll just start with the wood element. So with the liver, we can see imbalances with the liver blood. We say that the liver chi, which is the vital energy, can become stagnant, and that's where folks have stress and all of those like different emotions can cause the energy of the liver to stagnate. We talk about an imbalance of the liver yin or the liver yang. And so for the heart, the same thing, the chi of the heart, the yin of the heart, the yang of the heart. Um, for the spleen, we talk about the chi of the spleen, the yang of the spleen, and we even dampness. And so I don't want to get too intricate. I don't want to bore you with all of those details and stuff. It can be a little bit heady. And so, based off of the Chinese medicine diagnosis of what organs may be imbalanced, which again relate to the five elements, we will then determine which acupuncture points that we use. We know with acupuncture, we're dealing with the 12 meridians. Those 12 meridians or channels relate to 12 different organ systems in the body. And the order they go from the lungs to the large intestine, which are paired organs, to the stomach, to the spleen, which are paired organs, to the heart, to the small intestine, which are paired organs, to the urinary bladder, to the kidneys, to the pericardium, which is the area around the heart, to the triple warmer. Is that right? Yes, to the triple warmer. We call it the Sanjiao, to the gallbladder, to the liver, and then back to the lungs. And your body's vital energy, circulates throughout your whole body over the course of 24 hours. And so here in New York, it's 1:30. So the chi is in the small intestines right now. Here in New York, and I think out there in Egypt, y'all are, I think 6 or 7 hours ahead. So you're in a whole nother organ system right now with that. When we're dealing with acupuncture, we use, with acupuncture, we use little thin needles that puncture the body. And so from a Chinese medicine standpoint, we talk about how acupuncture helps to pretty much balance the qi and blood, the yin and yang, or the yin and yang. From a Western standpoint, when you look at the skin, there are many sensors on the skin for temperature, for pressure, for pain, and other stimulus in our environment. If we puncture the body anywhere, it sends a signal to the brain, and the brain responds by sending a signal back to that area where the acupuncture is being done, and sends more white blood cells to the area. It sends more red blood cells to the area. It causes different endorphins and pain relieving sort of chemicals, and all sorts of natural cells and chemicals to the body. So literally right in the area where the acupuncture is done, it creates almost what you could say like a chemical soup, which is pretty much a healing response in the body. One of the interesting things about acupuncture is that we not only do acupuncture locally where the source of the problem is, but there are a lot of styles of acupuncture where we treat distally. So there's whole systems where we just do acupuncture, which addresses everywhere in the body, and we only treat people below the elbows and below the knees. So in different places where folks say may have modesty and don't disrobe and take their clothes off, you can actually do acupuncture just from the elbow to the hands. With other styles of acupuncture also, we also do auricular, which is ear acupuncture. And so if you look at the ear, it looks like an upside down baby, where the lobe of the ear here is it looks like a head. This area in here is like the spine, the arms and the hand come in here, and then in this area in the center is all your vital organs, and so on and so forth. And so there are whole styles of acupuncture, masters of acupuncture, that only treat people from the ears. It's very effective. Sometimes we use scalp acupuncture. So when we're looking at scalp acupuncture, we're actually, even though of course we're not going through the scalp, through the bone, just by needling on the skin above the brain, it affects those parts of the brain that rule different parts of the body. And so you have parts from the center of your brain down the side that rule like motor function in terms of movement, and other parts that rule sensory function in terms of how we feel things. When you study the brain in regular Western or just basic anatomy and physiology, different parts of the brain again rule different parts of the body. And so this, we call it a homunculus. The center of the brain here rules the, at the top here, at the top of your head, is like the feet coming down with your legs to the center of your body to all the way to where your head is here. And so sometimes we'll do acupuncture on the scalp, oftentimes for people that have had a stroke. So if someone's had a stroke and hemiparalysis where half their body is paralyzed, we'll actually do acupuncture on the scalp and that part of the body to reconnect that brain body um, connection. When I was in school in 1999, I had a chance to visit China and Tibet and also do some studying out there, and met some master teachers out there who taught me some real interesting things, and even tuned me in to a Taoist brotherhood out there. But while I was out in China, when I was in Beijing and some other cities, we visited the Chinese medicine hospitals out there. And so with the hospitals, there was one patient I remember who had a stroke. And so he went to the Western hospital where they stabilized him and got him better. But after a few weeks, they pretty much said, you need to go get acupuncture because there's nothing else that we can do for you. And so with the acupuncture hospitals out there, they actually have inpatient patients, um, inpatients, you know what I'm trying to say, patients who are there as inpatients. And they're sometimes receiving acupuncture 2 or 3 times a day. Um, I remember they had the oxygen mask on, and they actually had a special tube where they had herbs boiling, and the steam was coming up and going through the oxygen mask from the herbs. So some of the patients were actually breathing in the steam from herbs in addition to the oxygen. Very interesting. But going back to the stroke patient, he was there at the hospital for a couple weeks receiving acupuncture 2 or 3 times a day for um, the hemiparalysis, and he actually began to get movement back in that side of his body. And so the scalp acupuncture is one of the things that they use for that. Something in my private practice, along with acupuncture, that I oftentimes use with my sports medicine patients is electric stimulation. And so, just like a TENS machine where you put the pads on the skin, um, similar but different sort of machine where we actually have clips where we'll clip the wire from the machine to the acupuncture needle, and the machine will use it at different frequencies, whether you're talking about 1 hertz, 2 hertz, 5 hertz, 15, and those different hertz, when we put that on the needle and turn it up to where the body can feel it, it causes the body to release different types of endorphins that are pain relieving. it'll also cause the muscle to like fasciculate. So if I put it here, I'll actually see just from the acupuncture needle and the electric stimulation, the muscle jumping like that, which has a very healing effect on the body, similar to TENS and massage. Again, what brought me into this medicine has been herbal medicine. With this whole corona pandemic that's going on, I've been very busy. Here in New York, they closed down all businesses that aren't considered essential businesses. And so my acupuncture practice, again, I've been in practice since 2002, 2003. In private practice, they told us we have to close down for now. And so I've been providing a lot of herbs that are very helpful for boosting the immune system, for strengthening the lungs. I'm doing a lot of consultations for people that have flu and pneumonia as related to, especially related to like this whole coronavirus thing and other things. And so when we're looking at herbal medicine from a Chinese medicine standpoint, there are, I think it's about 19 different categories, if I'm correct. Um, and in those categories, there are even subcategories. So some of the categories might be um, herbs that release the exterior, or herbs that make you sweat, open up your skin. And subcategory might be warm herbs that do that, or cool herbs that do that. An example of a warm herb that releases the exterior, makes you sweat, also opens up the lungs and even the digestion. A warm herb would be ginger. And another herb that's cool, that has some of those same properties, but instead is cooling, is something as simple as mint. Um, and so you have other categories that clear the heat in there. You have herbs that clear the heat from the blood, clear heat and dampness, clear heat and toxicity. So we're seeing like viral breakouts. A lot of times that's heat and toxicity and dampness all mixed together. You have herbs that help to drain damp, so get rid of excess water out of the body. Um, Herbs that tonify, and so you have herbs that tonify or strengthen the chi, that strengthen the blood, that strengthen the yin, that strengthen the yang. And so under that, when I was in school, I probably learned about 300 to 400 different herbs within all of the different categories. Just like there are the 12 acupuncture meridians that we talked about, each of the herbs go to a specific channel. So say like ginger, it goes to the lung channel, into the spleen channel, where other, and so with folks that have imbalances with their diagnosis with the lung and the spleen, um, so ginger might be one of the herbs that I might give to them. So some things would be, um, for like ginger would be if someone catches like a cold. So if someone's outside without a scarf on and it's windy and it's chilly, that wind can literally go up into their neck and cause them to have get chills, get fever, um, body aches, uh, even go to the stomach sometimes and cause an upset stomach. Ginger is an excellent herb if we catch it, especially in the beginning stages of literally just causing the body to sweat and letting that wind and cold out of the body through sweating. And so each of the different herbs go to different channels in the body. Um, each of the different herbs, also we break it down into tastes. And so again, the tastes are sour, bitter, sweet. Under sweet is also like bland. Then you have herbs that are pungent or acrid. Ginger would be an acrid herb, a pungent herb along with some other flavors. And then we also deal with herbs that are salty. Many of the herbs have multiple flavors. And again, when we talked about the 5 elements, each of the flavors also correspond to different organ systems of the body. We talk about the temperature of the herbs. So some herbs are hot, some herbs are cold, some herbs are cool or warm, slightly cool, slightly warm. So if someone has a lot of internal cold, where it's difficult for them to get warm, even if they get cold. Even if they're putting on clothes, they're still very cold. An herb that we would give them to that would be a herb like dried ginger, which is even hotter than fresh ginger. Where if someone has like a hot condition where they have fever and headache and just sweating a lot and their skin is red and you can see their tongue is red, if I give them ginger, it will actually damage their body even more. So we have to really be careful when we're prescribing herbs. So Allah asks, does the heat or the cooling effect of the herbs have properties itself? Besides then, the effect of the herb, does that mean mint would be equal to ginger or everything has an effect? Yes, every herb has an effect, but we do use ginger. I use ginger and mint very similar. I use them in a similar way, except for like the cooling and hot effects. I think I might have answered some of your questions, or I might answer it as I'm talking. So again, when we're talking about the taste, we're talking about herbs that might be sour, and sour is under the wood element, which relates to the liver. So sour can stimulate the liver and can stimulate the liver and the gallbladder, or too much sour can actually damage the liver. Bitter herbs, we say, help with the heart, but bitter herbs are also very drying. Um, when people have different, you'll notice a lot of herbs that have like an antiviral, antibacterial effect, they're oftentimes very bitter. In the same way you don't like that bitter flavor, the different microorganisms don't like that flavor, which has like a lot of alkaloids and things like that to destroy those organisms and get them out of the body. We also deal with the sweet flavor. A lot of foods that are sweet are very strengthening and tonifying to the body. So in addition to things that you would expect to be sweet, like fruits, we also consider grains to be sweet. So like rice, millet. So when you make like a porridge, like first thing in the morning, like a real soupy rice or a soupy millet or just some sort of cream of soup, those are actually very strengthening and tonifying for the body. Those soups are also very nutritious, and a lot of times we'll give those to our elders because we cook them for a long time to make it into that soup. It's pretty much like pre-digested, and easy for them to process in their digestive system. With herbs, we also deal with the function of the herbs. So you may have an herb in the category which is invigorate the blood, which is pretty much increasing the blood circulation. Um, there's certain herbs that, in that category that increase the blood circulation, but you have the indication for when we use it. So some herbs may increase the blood circulation to the heart. So if people that have heart disease, angina, chest pain, some herbs can increase the blood circulation to the womb. So when women have different menstrual issues, there are herbs that are specifically for that in that same category. And then when we look at pain, we also talk about how pain is a poor circulation of the blood also. So if someone has knee pain, there are herbs which will direct all of the herbs in a formula to the knees. And when we're looking at herbs, we will look at them. We usually use formula. So we usually don't have something where it's like, what herb is good for this or what herb is good for that. We use a whole bunch of herbs in order to create pretty much a balanced formula which addresses all of the person's signs and symptoms of whatever condition that they have. And even going back to diagnosis, even if someone isn't showing up with disease now, like I say, to rewind the diagnosis, when we go and look at the 10 questions and feel a person's pulse and look at their tongue, we can actually look and say, hey, if you keep doing what you're doing now, in the future, you will have digestive issues. You will have liver issues according to that to Chinese medicine. And so with the herbal formula, we address all of the different signs and symptoms that a person's having according to their chief complaint. And we also treat a person according to their body constitution to balance them out, to help them out for today. And even with a lot of this medicine, I think about it as a person strengthening themselves now, but you're also banking up on your health for 20 years, 10, 20, 30 years down the line. One of the best things I can hear from my patient when I ask them how they're doing is they're fine. Nothing is going on. That's one of the best things to hear. That means we're keeping you balanced and so that you don't get sick. On that same example, we talk about there are three levels of health. There's three levels of medicine. The lowest level is going to the doctor after you get sick, which is pretty much the medical model that most people are used to. That's likened to forging weapons to a war after the war has already started. It can help, but it's already a bit too late. Or it's not too late, but it's already you're already in the middle of a crisis. The middle level is preventive medicine. So that's when we're looking at your body constitution and giving you different things to strengthen it, to support your body constitution, to keep you healthy, so that you don't get sick. The highest level is when we are having someone so healthy and so in tune with themselves that they're in tune with their surroundings, and they're actually fulfilling their life purpose. So acupuncture works on a physical level. I've definitely experienced acupuncture working on a psychological level, and I would dare even say like a spiritual level. When we look at the different organs of the body again and the five elements, we have an aspect of your spirit that correlates to each of the organs. So when we're looking at the heart, we say that's the heart shin. That's the heart, that's your spirit that's like connected to your soul, connected to the whole universe, where um you get your almost like your life purpose from there. The energy of the liver is the general. That's like your body's intuition. When we're dealing with the lungs, that's dealing with like the animal spirit. So that's like your instinct. With the spleen, that's dealing with your ability to um, create ideas. And the energy of your kidneys are like your battery pack in the body. And so the kidneys relate to like willpower and all of those sorts of things. And so together, all five of your body's internal organs work together like a family so that ultimately we're able to fulfill our life purpose. So another tool that we use to heal is Tui Na, which is a name pretty much for like acupressure massage. And so if someone doesn't do acupuncture, you can also learn massage and stimulate all of the different acupuncture points in the body. There are about 360 something, maybe 365 points that correlate to the different, of course, how many days in the year, along with other extra points in the body. And so you can massage all of the points by pressing them, different hand techniques where you might be rubbing the body. I might do a technique like this where I'm rolling. We do a technique that's like a one finger meditation, like this, techniques where I'm grasping the body like this, so on and so forth. There are many different techniques that we use to help to strengthen up the chi and the blood, to help with the chi and blood circulation within the muscles, break up any knots, and all of those sorts of things. And actually, when I was in China, they actually have doctors of um, just of massage. Another thing that we deal with is nutrition. So how we use foods to heal. We know um, food is medicine. And similar to herbal medicine, every single food that we eat is broken down into different categories. So each of the foods, just like herbs, onions and garlic and broccoli and spinach and rice and all of these things, actually travel to different meridians of the body. Foods have taste, as we know, different tastes: bland, sweet, sour, pungent foods. And all of those foods, according to that taste, is affecting specific organs of the body. Foods have different temperatures. And foods similar also have a function and an indication. And so we can literally give someone a delicious recipe that's for lung congestion or for back pain or for irregular menstruation and things like that. We also do Qigong. Qigong are the sort different exercises like Tai Chi, which isn't the same as the Tai Chi symbol, but that's another story. Tai Chi, people are familiar with that, um, is a form of Qigong. And when we're dealing with Qigong, we're dealing with breathing, focus, and posture. We also do internal Qigong, where we're meditating on the different organs of the body. There's some meditations that I do. One is called Fusion of the Five Elements. One of my favorite meditation teachers is Montauk Chia, where he teaches Fusion of the Five Elements, where we take all of those different correspondences from the five elements and put that correspondence in the organ. So I may meditate on the liver. And again, the liver is the color green. So literally meditating on the color green with the liver, bringing my eyes and connecting that to the liver, because the liver opens up to the eyes, the tendons and the joints, bringing, meditating with all of that. We say the planet that rules the liver is Jupiter. So literally visualizing and meditating on the planet Jupiter and bringing that down into my liver. And that corresponds in its own way with the different planets and taste and temperatures and sense organs to the other elements. And so that's like internal Qigong. Some people also use Qigong where they're actually able to emit energy out of, some of those that are trained in it emit energy from our hands, similar to like Reiki, or even like spiritual healers may do like quote unquote healing touch. And so all of that is a form of Qigong, whether we're dealing with different movements where we kind of inhale and exhale and do certain things, and all of that helps to with the circulation of our chi, helps with our body's flexibility. We say a moving hinge catches no rust. So we want to keep our body moving so that we don't rust and we stay men and women of steel like Superman and Superwoman. A technique that's become very popular over the last couple years, especially with the Olympics and some of the Olympian swimmers, Michael Phelps and all, is cupping. And I'm sure those of you in Egypt, I'm sure your grandparents and things have all done cupping. We also use cupping to help with the blood circulation, almost thinking of it as almost like a reverse massage, where it brings the blood, old stagnant blood, to the surface. Stagnant blood, body fluids to the surface, um, out of the intercellular space and back into circulation. When that old blood and fluids is moved, fresh blood and fluids can get to that area and heal it. Um, and the last thing that I'll go into is Moxibustion, where Moxibustion, well, I have one more after this. Moxibustion is when we actually use an herb called mugwort, and sometimes we'll form it into like a long, almost like cigar sort of thing, light it on fire, and the burning tip will be burning, almost looks like a cigar or a cigarette, and we'll just hold it over the different points of the body to like warm the circulation. I'll tell you a quick story. A good friend of mine, he had the beginnings of almost like the flu a couple years ago, where he called me and told me that he was freezing. I went to his house. He had 2 or 3 coats on, literally winter coats, and was still frigid. So he had to heat himself up from the inside out. Like dried ginger along with other herbs would have been perfect for him at that time. And so I had my Moxibustion, a little Moxibustion stick with me. And so like he felt so cold and weak that all he literally just put out was his hands. And so I did the Moxa and I warmed it over this point for maybe like 5 to 10 minutes. And he said he can literally feel the heat from the blood as it was traveling through this area. He could feel the heat just warming through, going through his body and heating his body. And it literally jump started his own heat and circulation and ability to heat himself, and he felt better the next day. Where that literally probably, if it would have continued, could have possibly turned to the flu or even worse, like pneumonia. And so we'll use it for that. A lot of times I'll use the Moxibustion. Actually, I really don't use Moxa as much. I use an infrared heating lamp because the Moxa, it creates a lot of smoke, and it fills the whole office. And so a lot of people still use it, but I don't use it as much. I use an infrared heat lamp, and the heat from the infrared also penetrates deep through the muscles to help with the circulation and release pain. A quick story, another story with that is a patient of mine who had a lot of pain in her knees, very thin woman, and I was doing acupuncture on her maybe 2 or 3 times a week, and she was getting better, but we kind of got to a point where she was just stuck. And every day, and she was getting treatment in the winter, and she would always say how cold her knees were. And so one day I put the heat lamp on very close to her knee and literally like baked her knee, where someone else in a few minutes would have said it was too hot. And I left her there for about 40, 45 minutes, and her knee literally like was drinking the heat like it was water. And that was the breakthrough. And from there, her knee felt a whole lot better after that. The last thing I'll talk about is gua sha, which is like a scraping technique, also another traditional technique you might see out there. I've seen it all through in like Vietnam, other parts of Asia, where some people use a coin, where especially like on the back and the neck, if someone has some sort of like wind cold or stiffness and cold in their neck, they'll put like a little oil on it, or Vicks or something like that, and we'll use like a soup spoon or like a horn, and it's like a scraping technique. Sometimes people use like a coin, and then they'll just kind of scrape the area, and it causes like a slight irritation, which causes a healing response in the body. And so, I've been doing this work for a while. I have a full practice. It's a little slowed down now, but currently I'm doing a lot of herbs, helping a lot of people during this corona epidemic, or pandemic, you should say. And the interesting with it, and I tell people I'm not treating coronavirus. I'm treating the signs and symptoms of how it shows up in the body. So some of these same signs and symptoms of coronavirus show up in other sorts of diseases before this and after this. And so when we treat the person, when we treat the body, when we treat what's in front of us, people get better. And so I will end it there. Thank you. If anyone has any questions, please put them in the chat, and I will answer them. And thank you for your time. I have to get off in a few. I have a bunch of orders for herbs that have come in, and I have to get back to that. But thank you all for tuning in. I hope it was helpful, and you're all able to follow everything that I was saying. And I'll go from there. So please, any questions? All right. If not, I will say thank you for your time. One person asked, how can I start to learn herbology? Oh, you're welcome, Allah. With herbology, I mean, some people, herbs is one of the first medicines. Every scripture speaks about herbs as medicine, as our food, as our medicine. So you can basically learn on a basic level for yourself herbs from books. And if you're really interested on a professional level, I would definitely say find a system that you like and study that. Whether you talk about traditional Chinese medicine, with India, they have a fantastic medicine, Ayurveda. I'm sure there are some traditional systems. I don't know how popular they are out there, but some traditional systems where you are. And yeah, so go from there with the herbs. So again, thank you all for your time. And I will say salam and end there. Peace.